Hello. In this video, we just wanted to spend a few moments talking about how you can make the most of the F3 year, if that's what you've chosen to do. So, as discussed in the findings of the report, the reasons people choose to take a year following completion of the foundation programme are individual and multifactorial. And as such, when considering how to make the most out of this year for you, it's really important to be clear on your reasons and on your goals. I'd also like to just acknowledge that for some, progressing directly to specialty training is the right thing for them, and that's absolutely fine. I'd also like to acknowledge that for some, the possibility of an F3 isn't an option, either due to financial reasons or job security reasons, and that's also absolutely fine. If you do choose to take a year away from a training scheme following the foundation programme, here are some tips on making the most out of it. Number one, think early on about what you want to get from the year. Is it experience in a certain specialty? Is it some more personal time away from work? Is it to engage in further education, travel, a specific non-clinical specialty? Considering this really early will help you focus your exploration of what options are available. And that brings us to point number two, exploring your options. Without focus, these can seem endless, and that's why it's really important to consider those goals. If working in a certain specialty is your priority, explore the NHS Jobs website with that search term in mind. Contact the department in local hospitals to ask about potential locally employed doctor roles and talk to different members of the team. Within this context, you'll be looking at locally employed trust grade posts or fellowships. A fellowship can often come with associated research, teaching, quality improvement or leadership components, whereas a trust grade post is more likely to be a purely clinical post. If you're considering working abroad, that will require application processes and often visas, and it's also a big change. So talking to someone that's done something similar in a similar country to one that you're hoping to travel can be really important. If you're looking at further education, applications for certificates, diplomas and master's programs can be time consuming. So exploring the courses, choosing where you want to apply, and having an awareness of the timeline will help. Also consider when you want to take the course, because undertaking education at the beginning of the year can provide opportunities for later months. For example, through the Diploma of Hygiene and Tropical Medicine or Expedition Medicine, you may be equipped to apply for overseas work in the latter parts of your F3 year. If you're looking to work as a locum, then research agencies, joining requirements and shift availabilities are necessary. It also may be that this time is for you to recharge, to recover from burnout or exhaustion of previous years and to focus on personal things outside of medicine. So considering the financial requirements of that within this year are important. But aside from that, just remember that it's absolutely okay to also take that time for yourself. Number three, getting started. So you've decided what to do in this year, and we know that for many of you, that's going to involve clinical work and subsequent experience and learning alongside that clinical work. So do you want to log your learning? And if so, how? We know from the recent study and the report that many people are looking for a break from these training requirements. However, it may be that you want to consider how keeping track of your learning and procedures could help with applications and future training. So you can pay a fee to have access to an ePortfolio within the specialty you're interested in as a non-training grade doctor. Although you won't be required to undertake ARCPs and there'll be no minimum number of assessments, it can be a really useful way to log your learning and to gain feedback from colleagues. Alternatively, you may want to consider keeping a more informal log that can be accessed when you come to applications and interviews. Number four, planning for what comes next. So due to the timeline of training, you may not be far into your post-foundation year before you come to apply for a training programme that begins the following year. So make sure you're aware of application timelines and interview dates. This will be really important in planning your shifts if you're working clinically, organising courses and education, and if you're travelling abroad, working out when you need to be within the country for interviews. Finally, number 5, looking after yourself and getting what you need out of the year. So this year is likely to be different to your foundation years, with less structure in terms of educational provisions, allocated supervisors and designated CPD. So as such, we've made a subsequent video discussing the options you might want to explore just to ensure that you're supported in the right way to meet your goals and your needs from this year. Thanks for watching.